Okay, welcome everyone. Thank you so much for joining us today. My name is Lauren and I'm joined by Corey. We're the educators here at Iris. So as you may know, we conduct periodic webinars in conjunction with our newsletter. These are meant to provide additional resources and support to our clients as you are facilitating your Iris program in your organization. So a couple of housekeeping things regarding the webinar. Everyone is on mute, but we do encourage your participation. So there's a Q&A box at the bottom of your screen. If you have any questions at any point during the webinar, please feel free to click on the Q&A box and type your question to us. We will do our best to answer all questions during the webinar. If your question happens to be specific to your organization, we will be happy to follow up with you after the webinar. So don't hesitate to put any of your questions there in that Q&A box. Another thing we want to make sure to note, this webinar does not take the place of any hands-on training that you should be receiving from the super users in your clinic. So if you're a new user to Iris, we're going to give you some fundamentals and some basics regarding the exam and the program, but this should not take the place of your additional training with the super users at your clinic who are performing exams. We will also not be addressing any sort of billing questions today. Those are all very specific to your relative organizations. So we will defer to your administrators and managers on any questions regarding how your organization handles billing and referrals. So that being said, we're going to go ahead and dive in. So we want to talk first about why the exam is important. So everyone, you're very busy. You've got a lot going on in your day-to-day, whether you're in clinic or you're doing in-home visits. And so it's really important to connect to the why behind this exam. So why are we doing this exam? Why is it important? Why are we performing it in point of care settings, such as primary care or in the home? And so the reason for that is there's a lot of people in the United States who have diabetes. Right now, the number is around 40 million. That number is continually growing. And less than 50% of people who have diabetes are receiving their annual diabetic eye exam. So this is a really big gap in their care. And so a lot of people are about to go blind. About 3 million patients are at risk of losing their vision right now from diabetes. Diabetic retinopathy is the leading cause of blindness in the United States among working age adults. So this is a very real thing that is happening to people every single day. They're losing their vision from their diabetes. And the thing about that that's really so challenging is diabetic retinopathy is very easy to treat when it's caught in early stages. So Corey's going to talk a little bit more about diabetic retinopathy and how it impacts our patients.
One thing I do always want y'all to think about is just think you have five senses, and of your five senses, personally, which one would you hate to lose most? I bet if we took a poll right now, a majority would say eyesight is the most important of your five senses, because it is for me. That's why I wear glasses. I want to see the best I can. But if diabetes has that chance of taking away your eyesight, that is such a challenge for somebody who may have had perfect vision into their 20s, 30s, 40s, 50s, 60s to go blind due to diabetes, which was preventable. That's a life-changing event, and it's very, very tough to take place. So moving on to the next slide, we're going to look at some images. So if you look over here on the left side, this image is an ideal image. This is what we want every diabetic patient to have. I don't want them to have pathology because I don't want their eyesight to be affected. But again, we see a lot of patients that do have some type of pathology, and you can see the difference in these two images. So diabetic retinopathy, you can see all the little red spots all throughout the eye. Those are little blood hemorrhages, little busted blood vessels that start leaking out blood, clear liquid, and some fats. Then we see some of the yellowing around where the macula is located. Those are actually fats that have been deposited from the blood vessels. These all impact the eye. A lot of the blood spots create black spots in their vision. So almost call it like a cow vision, and it's really hard for a diabetic to recognize until it's way too late. They don't notice it in the early stage, they notice it in the late stage. And by the time they notice it, diabetes has really affected their eyesight. It's going to impact their livelihood. So This right here is an image just of a Florida highway. This is a patient without pathology. Now, just like we saw in the right image, we're going to go to the next image, which is going to show you what their vision looks like impacted. Now, the thing with your brain is always trying to help you. So when your right eye, if your right eye is being impacted and your left eye doesn't have the same like issues, well, your left eye, your brain's going to fill in all the spots. Just like you know you have a nose, but you can't see it because your brain's taking it away. You can see in the mirror, everybody else can see it, but you can't because your brain helps you, right? So even if your right eye is being impacted, your left eye can fill in. That's why it's so hard for a diabetic to recognize until it's way too late. By this stage, they're going to lose their eyesight. And it exponentially gets more expensive the later stages you are, up to like we've heard $7,500 per eye per injection is like on a very high end side. And that's not like done once every 5 years. That's done like every 6 months or every quarter, whatever's needed for the patient. And they're just trying to prolong their eyesight, essentially.
Absolutely. Diabetic retinopathy can happen at any age. So Corey and I have been on site with countless clients where we have seen people, I've seen people as young as 30 with moderate and severe diabetic retinopathy and macular edema. You would not look at these people and think that they're already losing their vision because of their diabetes, but they absolutely are. The longer that someone has had diabetes, the more likely they are to be impacted. So it's really not a question of if this happens, but when. Obviously, managing blood sugar is a really big contributing factor to preventing diabetic retinopathy from coming sooner. But it's been our experience, if we're on site and we do at least 10 exams, at least one or two of those people are going to come back with some type of pathology. And frequently it's sight-threatening pathology. So this is, again, a very real impact that you can make on your patients simply by performing this exam at point of care the same way we do, foot exam or an A1C.
And every region is a little different, but from what our kind of average is, somewhere between 20 and 25% of the patients have pathology. So that means, just say on the low side, the 20%, if you let 5 diabetic patients walk out of your office without getting an exam, one of those most likely had some type of pathology that you could have potentially saved their eyesight by just performing the exam.
Absolutely. So we're going to pause here real quick. We just want to get a bit of a sense of where everyone is at in terms of whether they performed exams. So we're going to start diving into a little bit more about performing the iris exam. And so we just want to see where everyone's at in terms of having performed an exam before. Maybe you have or you haven't. So we're going to launch a poll. There's just 2 questions, and it looks like we've already received a few answers. We want to know how many exams you performed, and then the second question, if you have performed exams, how long has it been? So it looks like we've got a good mix of kind of newer users and people who are a little bit more experienced. So if you haven't taken a moment to answer the questions on that poll, go ahead and do that for us here real quick. And again, we're just trying to get a sense of, where everyone's at in terms of their experience with the iris exam. All right, just a few more moments. Got a chance to answer those questions. All right. So again, a good mix of people who have not performed exams and people who have, and some variations in how long it's been since those who have performed exams before have been able to do so. So as you may already know, practice is a big factor in being comfortable with performing the exam, just like learning any other process. It's really important that we keep our skills up. So we're going to talk a little bit more about that process. What are we doing during the exam? So we want to perform the exam in a darkened room. What we're doing, we're taking a picture of the back of the patient's eye. The back of the eye is called the retina. We're viewing the retina through the pupil. So we want the pupil to be nice and big during the exam. We want those patients to be naturally dilated when we perform the exam. So the darker the room, the better. We want to make sure that the patient is comfortably seated in that dark room. And then once we get those lights turned off, that dilation process starts for our patients and for us. There's a clinical impact to dilation. So we want, again, to see the back of the eye through the pupil. And so these are two examples. On the left, we have an undilated pupil. We can see much less of the back of the eye when that pupil is not dilated. So having those pupils dilated by being in a dark room allows us to see the parts of anatomy that we need to capture for us to have high quality images and gradable exams. Again, there is that clinical impact because we need to be able to see the anatomy. So some organizations offer the option for you as a camera operator to leverage dilation drops. A very mild tropicamide solution gives you a little bit of a boost for those patients who don't dilate very well naturally. So every organization is different. Some operators are leveraging natural dilation techniques only. Some, again, do have that option to use the dilation drops. But again, your job is going to be a lot easier. You're going to be able to capture high quality images, especially if you're one of the operators using a handheld device. The bigger your patient's pupils are, the better. And then Corey's going to talk a little bit about what our images should look like.
So we always kind of ask ourselves just a few questions. Number one, is it clear and in focus? We want to make sure the image itself is nice and crisp. Are there 4 parts of anatomy present? I always like for you to count to 4. We're always counting each part of anatomy. We want to make sure we have all 4. Now, sometimes with the handheld, you'll see this more often than not, where you may not have all 4. Just remember, you can capture a second image of what's missing, right? And then make sure the anatomy is in the correct position. So if we're looking at this image, this is a left eye. The thing that tells us this is a left eye is where the optic nerve is located. So whenever we have the optic nerve in the ideal spot on the left side, think of a clock. We want to see it, or for this image, this is the right eye. We see the clock, it's letting us it's all good. It's letting us know which eye we have taken. We always want to see the optic nerve. So for the right eye, think of a clock. We want to see it in that 3 o'clock range. If for the right eye, that optic nerve is anywhere else, we're going to be losing anatomy. So it's always ideal to be in that 3 o'clock range. For the left eye, we want to see it in the 9 o'clock range. Anywhere else, we'll be losing anatomy. Just think if it's in the 7 o'clock range, we're going to miss half the anatomy. So it is ideal whenever you have it in that right spot. The arcades will curve around the top and the bottom, and then the macula should be the center of our photo. So again, we always like to count. We want to count each part of anatomy because we have to present the grader with all 4 parts of information they need. Just the same thing as an EKG. If you ever did an EKG and you miss one lead, you're not providing the cardiologist with all the information they need, right? Same thing. We need 4 parts of anatomy per eye. As you can see over in number 1, the optic nerve, very important because that tells us which eye we have. We know if that's in the correct location. All the other anatomy should be in the correct location as well. Number 2 is the macula. This is the center of our vision. Now, the macula does look like a shadow. It looks sometimes can look like a dot. Every eye is unique. I just don't want any shadow near it because then I'm going to say I can't see it, and it's very important. This is where macular edema is diagnosed. Then we have the arcades. We have the superior, that's number 3 up there, and then the inferior, which is the bottom one. Now, you see the dark, big, thick vein, right? That is the kind of the top, and all the little ones fall in. That's where diabetic retinopathy a lot of times is going to be diagnosed in. But we want to make sure we count every time we take a photo. Just remember, if certain times, if you're missing one part of these anatomy, I need to take another one trying to capture what's missing. And that's primarily with the handhelds. Desktops are slightly different.
Absolutely. So we received a question regarding image quality. And the person asks, if one is taking the photo and they see all 4 parts of anatomy, why would the image not be gradable? And that's a really great question. And we see this a lot where even though the 4 parts of anatomy are present and they're in the correct location, they don't meet one of the final pieces of criteria, which is going to be that they are clear and in focus. So these are the 3 things we need. Having the 4 parts of anatomy present is just the first step. We need to make sure they're in the correct location, and then we need to make sure they're clear and in focus. So I've seen images where the anatomy was present, it was in the correct location, but because that image was blurry, the interpreting provider didn't feel comfortable making a determination whether pathology was present. If you're ever questioning whether, why images are coming back not gradable, the interpreting provider does give a little bit of feedback when they're selecting the not gradable reasons. So you may see something like media opacity or camera focus. You can also always reach out to Iris. You can contact our help desk and ask us to take a look at the photos. We can give some feedback on perhaps what you can do to correct the issues in the image so that your images are more likely to be gradable in the future. So we are always happy to provide that resource to all of you to make sure that you have a good understanding of what's happening in those images. Great question. All right, so this is what we're shooting for. We want to make sure that our images are as high quality as possible. Many of your cameras are going to allow you to take multiple images. Like Corey mentioned, we want to show a comprehensive view of the anatomy. You don't necessarily have to remember the names as long as you know what they look like. And again, where they're supposed to be. So we want to make sure that optic nerve is correctly placed. That optic nerve moves based on where the patient is looking. So that kind of leads us into our next portion. How do we want to present the exam to the patient? So we want to make sure that we're clearly explaining several things. The first thing we want to make sure is that the patient understands how important this exam is. We should be presenting this exam the same way we present an A1C. This isn't optional. This is an important part of their diabetic health maintenance. This is ensuring that they are not about to lose their vision from their diabetes. So it doesn't take very long. We can knock this out, and so that's the way we should be presenting it to the patient, right? This is a medical exam to check the health of your eyes. We can take care of that for you here today. And, we want to let them know we're just going to take a few pictures of the back of their eye. And then we want to make sure we're clearly explaining the exam to the patient. We want to make sure that they know what's going to happen. They're not going to experience any pain or discomfort. There's no puff of air. We're just going to take a few pictures of each of their eyes. They'll see a flash from the camera, just like from a regular camera. Depending on the camera type that you have, you will offer additional suggestions based on that camera. So if you're using a tabletop camera, it's important that the patient knows how to properly position themselves. We want to make sure that we're evaluating the patient's positioning, making sure that they're comfortable in the device, that their forehead is resting against that forehead bar, their chin is on the chin rest, and we want to make sure that they know where to look during the exam. If you're using a handheld camera, we want to make sure they're prepared for us to get close to them, that we're going to be touching them on their forehead or their temple to help guide the camera and steady the device. And again, they need to know where to look. So most of the cameras are going to have an internal light that the patient focuses on during image capture. If you're using a handheld camera, we want to make sure they know to cover the other eye while they're looking for that blinking light inside the camera. If you're using a handheld device with external fixation, we want to make sure that we're shining a flashlight on that glow in the dark dot so that it's nice and bright. Again, these are very little things that we can do to help set the patient at ease during the exam and ensure that they know what they need to do to help us capture high quality images. If the patient doesn't know where to look during the exam, they're not going to look in the correct location, and then your anatomy is not going to be in the correct location. So all of these things build on each other to make sure that we get high quality images. Anything else you want to add about what happens during the exam?
Nope.
Okay. So again, most exams take about 3 to 5 minutes. We get the patient into a dark room, we get them seated. We want to make sure there's some ambient light in the room initially so we can clean the camera eye cup or the forehead rest or the chin rest. We want to make sure that the patient is able to be seated and comfortable. We do want to make sure they're in a regular chair. We don't want to put them on an exam table or anything like that. And then once the patient is seated, we'll get that light turned off. We'll explain the exam to the patient, answer any questions they have. This allows our eyes to also start dilating. So the sooner we get those lights turned off, the better. And then we can go ahead and try to perform the exam. If you've got a tabletop camera, that camera is going to give you an indication of how large your patient's pupils are. If you have a handheld device, when you hold that device up, you'll be able to see how big their pupils are. And so then we can make a determination on what needs to happen next. So once we've taken those images and we've performed the exam, what happens next? Corey?
So this is where once you have submitted those for grading, they get sent over to our grading center. Our grading center reviews them and then sends the results back, where you will get a care plan that outlines what the grader had seen in the eye. If there was any type of pathology, like this one says severe pathology, please refer to a retinal specialist urgent within 2 to 4 weeks. It also gives us the diagnosis codes, as well as which eye had the finding, or if both eyes had the finding. So it gives your provider an outline and already predetermined, next steps for that patient. So results normally come back within 1 to 2 business days. But what I always tell everybody I train is, hey, tell them 1 week. They will get it faster, which is going to make them happier, but then you also aren't getting phone calls, so try to do that. But honestly, 1 to 2 business days, sometimes even faster. We have some graders who grade in like a couple hours. Some take a little bit longer, but still, you're going to get those results within 1 to 2 business days. Very, very fast to get the results back. Now, again, anything in the care plan that is found, again, you will want to pass this on to the patient as soon as possible. Again, like this one says, hey, they need to have an urgent appointment within 2 to 4 weeks. That seems like a little ways away, but retinal specialists are busy. They have lots of appointments. So you need to get that phone call going as soon as possible. Now, if there is no pathology, then the one thing they are asked is to come back once a year. Once a calendar year is what we want to have our diabetic patients, because again, you never know what pathology, how it affects. I was at a super user training with a group in Austin, and literally one of them told me that we had examined a patient 2 years ago who had no pathology. He decided to skip the next year, came back 2 years later, and he had severe pathology. So it can accelerate depending on how well they're taking care of themselves, and a lot of different factors. But a 2-year window went from no pathology to his vision being severely impacted, having severe pathology, which is like stage 3 of 4. So very important, this exam to be done at least once a calendar year. Now, a lot of insurance companies will cover this multiple times a year, so you don't have to stress about it. If you took one in November of last year, again, it's once a calendar. You could do it in July. If you're not going to see them again. Insurance most of the time will cover this. Can't speak for everyone, but yeah, essentially that. Anything you want to add?
Yeah, absolutely. So again, depending on your organization, your methods for accessing results and delivering those results to your patients is going to vary. So we may be integrated with your electronic medical record system. You may be getting those results back to your EMR. You may be accessing results from our portal or from a different method. Those results might be going to a different party depending on your workflow. So get with your managers, your super users, find out what your workflow is for accessing results. But as Corey mentioned, everything's going to be outlined for you. You're going to have a clear understanding of what the interpreting provider saw, if anything, and you're going to have clear patient instructions. This is a calendar year exam, so this is not like a physical where you have to wait for the 366th day. We treat this as a screening in this setting, but it is, a diagnostic exam. And so payers are prepared to reimburse on that. And so we just want to make sure, we're not holding back on doing an exam. If you saw them in May of last year and they're back in April, it's the next calendar year. So we can go ahead and perform that exam. So once you have a good foundation, right, for performing the exam, what's next? Like, what do you need to be successful in performing these exams in your setting? So the first thing you want to make sure is that you have been set up in the IRIS portal. And that's something that your manager or your administrator can do. If they have questions about getting you set up, they can always reach out to our help desk and we can help facilitate that process. Once you're set up, you're going to receive an invitation to the portal, and you're going to be able to access the IRIS portal, confirm your information, set up your profile, And that's what's going to give you access to our Iris University modules. So every organization has a curriculum that's specific for their workflow. It's going to be videos based on your internal workflow, your specific camera. And so those videos are going to give you a strong foundation for performing the exam. It's going to go into a lot more depth than what Corey and I have been able to do today. And so those videos usually take about an hour to an hour and a half to complete. It'll save your progress. So you can do this, kind of in between other tasks, while you're, completing your workday. And then you want to get some hands-on training with the staff that's already been trained at your location. So you want to make sure that you have a good understanding of performing the exams. What's your internal workflow in terms of getting orders placed, accessing those orders on the camera, performing the exam with your specific devices, accessing results afterward. It's really helpful if you can observe a few exams being performed by the operators who are already trained within your organization. And then if possible, you can even have them observe you while you perform your first exams. Just like any other process, it's going to take some time for you to feel comfortable and proficient. You are not going to feel super duper comfortable the first exam you do on a patient. Couple of things that really help with this. The first thing is practice. Practicing on your coworkers, practicing on the people who are already trained, getting an opportunity to take images of people so that you can get a better understanding of things before you start doing this on your patients. And then don't wait too long. So if you get that hands-on training from somebody within your clinic, and then 2 weeks, 3 weeks, a month passes before you try to do your first exam, you're not going to have a fun time, right? You're going to forget some of the things that they taught you. You're not going to feel really comfortable. And your comfort doing the exam is very important because that's going to be what ensures that your images are high quality and that you're able to do this quickly. The more uncomfortable our operators are, the less likely they are to want to do the exam. And then you kind of enter this feedback loop where you don't feel comfortable, so you don't really do exams. When you do exams, you don't feel comfortable, and so you don't really want to do them. I'm sure you can see where I'm going here with this. So we want to make sure that once we get that hands-on training, we go ahead and jump in, right? Just like any other process, practice makes perfect, kind of fake it till you make it, right? Any other process you've ever learned, it took some time before you felt proficient. There's lots of things that you can do in your sleep now that maybe felt a little uncomfortable the first time. So don't be afraid to go ahead and jump in once you get that hands-on training.
Can't stress practice, 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 practice. The more you practice, again, the easier this becomes. Once you have mastered and become the more comfortable you become, you don't have to practice as much. We take photos all the time. We make it look very easy, but we've had lots of practice. And everybody's like, oh, it looks so easy because you do it, because we have practiced to that point. We can't stress practicing. It is the most important thing you can do. Pick up the camera every day. Just take a photo, and sooner or later, every day you'll learn something new by doing that. But the good thing is like after a while, you don't have to pick up the camera anymore. You could take months off. It's like riding a bike, took you time how to learn it. And then once you mastered it, you could put it down for 6 months and pick it right back up. Very similar to this camera, because you just got to learn how to control, know what you're looking for, and when to press the button. Once you master those 3 things, it'll make it so much easier for you.
Absolutely. My joke is, 3 minutes a day keeps the ungradables away.
There you go.
So.
I like it.
Again, that Q&A box is available for anyone who has any questions. So feel free to drop those questions in the Q&A box. Just to highlight something that we mentioned a few times, we are available to you. We are here to support you. If you have questions, if you've encountered challenges or issues and you need some guidance, reach out to our help desk. You can give them a call or you can send us an email. If they are not the appropriate party to answer your question, we will make sure to connect you with the person that you need to go to so that we can make sure you have what you need to be successful in doing these exams. So this is not a case where, we kind of throw the camera at you and say good luck. We are here. Ongoing support is available to you anytime you need it.
We want you to succeed because you are kind of helping our mission, which is to help diabetics not go blind. So we want you to succeed because that also helps our mission. with diabetics.
Absolutely. It's a win for everyone, right? We're here to end preventable blindness and help you close care gaps, increase patient care. It helps the eye care providers in your area get access to that population that needs their treatment. So this is a win for everybody.
And I know, sorry, and I know some will say that this takes time. Everything takes a little bit of time, but the more you practice, the easier it becomes, and the quicker and more efficient it will be as well.
Absolutely. So we kind of kept this very general. Again, this was meant to be more of a foundational webinar to help you get a better understanding of some of the fundamentals regarding diabetic retinopathy and the exam. There are resources that are available to you specific to your organization. Get access to that Iris University, watch those videos, get with the camera operators at your clinic so that you have a good understanding of the specifics for you. We also have webinars specifically about capturing images with different types of cameras. So we'll be sending a follow-up email to you with a link to our YouTube channel where you can access that webinar. So again, lots of resources available to you so that you can have a better understanding of how your specific workflow works and how your camera works. All right. So we've got a question regarding sending test images. So that process for uploading images is going to be very specific to your camera. Those steps will depend on the type of device that you have. Some devices, handheld and tabletop cameras, you may be sending those images directly from the device itself. Some of the cameras have a step where you're going to dock the camera. The camera will be plugged into a computer and you'll upload images that way. So again, that's going to be specific to your workflow and the device that your organization has. So you're going to want to get with your trained operators so that they can give you that step-by-step on how to capture images and upload them from your device. Okay. Another question regarding a specific camera. So there is a button that you can press on the handheld device that has an iPhone attached to it. That's the Remedio camera. There's a button that you can press for the patients who have small pupils. And it's a circle with the word normal below it. And it's going to be in the upper right-hand corner of the screen. When you're viewing that screen in landscape mode, when that phone is rotated into a horizontal position. All right. I don't see any other questions. We're going to give a few more moments just in case there's anyone else who wants to ask a question. We send out monthly newsletters to you all. We have links to our previous webinars in those newsletters. So this webinar will be linked in our July newsletter. You can, again, always go to our YouTube channel to access previous webinars. Again, please reach out to us by email, give us a call. We are happy to facilitate any questions that you have to make sure you are set up for success and you have what you need. So all of the cameras will take pictures with pupils that are not dilated with dilation drops. All of the cameras are what they call non-mydriatic cameras. Now, the thing to bear in mind is everybody's pupil is going to be different. Mm-hmm. So pupils are like veins. So the first step, right, is to make sure your patient's in a darkened room. The darker the room, the better. And then we want to check, right? We want to see how big their pupils are from that natural dilation of being in the dark room. And then there's additional steps that we can take to help facilitate their pupils dilating. If you're using natural dilation techniques, we're going to keep them in that dark room for a little longer. If you have the option to use dilation drops, then that's something that you're going to want to use when that's indicated. If you've got someone with really small pupils, there's going to be a better chance of you capturing high quality images when you use those drops, if that's an option that your organization allows. So medicinal dilation is not required for any of the cameras on a regular basis, but that dilation process is going to be different depending on your patient and how quickly they dilate.
So on the next question is asking us to kind of reiterate the small pupil mode in the Remedio camera. It's in the image capture screen. Whenever you have the camera horizontal, In the image capture screen where you see your picture in the upper right, there's going to say a little circle that'll say normal. If you press that, it changes it to small and allows your picture screen to zoom in just a little more. So you're just tapping that to change it from normal to small pupil, or you can change it back. It always defaults to normal. So if you make that change and then you leave the screen and upload your next patient, it'll go right back to normal. But that's how you're going to change it. Just zooms in just a little more when you have that small pupil, help you get a little bit closer and hopefully capture a better image.
Absolutely. So we've got a question regarding patients with cataract lenses. This is not a contraindication or something that will prevent you from capturing images. However, if you're using certain camera devices, typically the handheld devices, you may notice a little bit of a rainbow or a halo effect as you're advancing the camera toward the patient. Again, this is not a contraindication or something that will prevent you from capturing images, but depending on the thickness of the lens, you may see kind of a stronger rainbow or halo effect, or maybe a weaker one if it's a very thin lens. So still take images. You may need to take a few images of the eyes to capture a comprehensive view of the anatomy if that lens is very thick. You can also kind of gently maneuver the camera to kind of reduce the glare from those lenses. So this is something that does take a little bit of getting used to, maybe something that throws you off a little bit the first time you see it, but it's not something that will prevent you from capturing high quality images. You just may need to make some slight adjustments to accommodate those lenses. Great questions. All right, I don't see any other questions, so we're going to go ahead and conclude the webinar. Again, we will send a follow-up email to you. If you have questions or you need assistance, reply back to that email, give us a call, submit a ticket to our support team. We are always happy and available to assist you. Like Corey said, we're invested in your success. We want you to feel empowered to have the information that you need to do exams. So we look forward to seeing you at the next webinar that we hold. And in the meantime, we're happy to help if you need anything at all.
And practice, practice, practice. Can't stress that enough.
Practice. Awesome. Thanks again, everyone. Have a great day.